Stroke is one of the most critical health issues not only in the United States, but around the globe. It is a leading cause of death and the primary cause of long-term disability among adults. The consequences of stroke go far beyond the patient's quality of life. It places a heavy emotional, financial, and medical burden on families and society as a whole. The good news is, with the right knowledge and timely action, many of the severe outcomes of stroke can be prevented or significantly reduced. In many cases, just a few minutes of early response can mean the difference between life and death or between a full recovery and lifelong disability. In today's article, we'll take a closer look at stroke. What exactly is a stroke, and why does it happen? How can you recognize the early warning signs, including subtle symptoms like slight facial drooping, slurred speech, or weakness in the arms or legs that are often overlooked in the first few minutes? We'll also walk through the critical first aid steps you should take the moment a stroke is suspected, because every passing second increases the risk of permanent brain damage. In addition, the article will share simple but effective prevention strategies such as managing blood pressure, reducing stress, maintaining a healthy lifestyle, and understanding your personal risk factors, whether you're learning to protect yourself or someone you love. The information in this article will equip you with the tools you need to take a proactive approach to stroke prevention and response. Because when it comes to stroke, being proactive is the most powerful weapon you have. 1. What is a stroke? Understanding this brain attack, our brain requires a constant supply of oxygen-rich blood to function. A stroke, often called a brain attack, occurs when the blood supply to a part of the brain is suddenly interrupted or when a blood vessel in the brain bursts. This deprives brain cells of oxygen and nutrients, causing them to be damaged or die within minutes. There are two main types of stroke. Ischemic stroke. This is the most common type, accounting for about 87% of all strokes. It happens when a blood clot or plaque, atherosclerosis, blocks an artery leading to or within the brain. These clots can form in the brain's blood vessels or travel from elsewhere in the body, often the heart, as in atrial fibrillation, and lodge in a brain artery. Hemorrhagic stroke. This type occurs when a blood vessel in the brain leaks or ruptures, aneurysm or arteriovenous malformation, a VM, causing bleeding into the brain tissue or the spaces surrounding it. This bleeding puts pressure on brain cells and damages them. Uncontrolled high blood pressure is a common cause. Regardless of the type, the result is brain damage, the severity of which depends on the location and extent of the affected brain area. 2. Recognizing stroke. Symptoms. Use F.A.S.T. Balance. Sudden loss of balance or coordination. Dizziness, eyes. Sudden trouble seeing in one or both eyes. Blurred or double vision. Face. Sudden facial drooping or numbness. An uneven smile. Ask the person to smile. A. Arms. Sudden weakness or numbness in one arm or leg. Ask the person to raise both arms. Does one drift downward? Speech. Sudden difficulty speaking, slurred speech, trouble understanding speech, or inability to speak. Ask the person to repeat a simple sentence. Time. If you observe any of these signs, call 911. Immediately. Note the time when the first symptoms appeared. Symptoms usually come on suddenly and often affect one side of the body. Sometimes, a person might experience a transient ischemic attack, TIA, or mini-stroke, where stroke-like symptoms appear but last only a few minutes to a few hours before resolving. A TIA is a serious warning sign of a future stroke and requires immediate medical attention. 3. What to do if you suspect a stroke. Every second counts if you think someone is having a stroke. Your calm and correct actions can make a life or death difference. Do this immediately. Call 911 or your local emergency medical services right away. This is the most important step. Keep the person comfortable. If they are lying down, position them on their side with their head slightly elevated. If they are vomiting, to prevent choking, loosen any restrictive clothing. Note the exact time the first symptoms appeared and provide this information to the NINDS personnel and hospital staff. Stay calm and reassure the person. Do not give the person anything to eat or drink. This can lead to choking if their ability to swallow is impaired. Do not give them any medication, especially aspirin or other blood thinners. If the stroke is hemorrhagic, these medications can worsen bleeding. Do not try to drive the person to the hospital yourself, unless there is no other option. NINDS personnel can begin life-saving treatment en route and are trained to transport the patient quickly and safely. Do not delay calling 911 to see if symptoms improve or to try unproven remedies. 4. Golden hour and critical stroke treatment and stroke care. Particularly for ischemic strokes, there's a critical window of opportunity, often referred to as the golden hour, generally within 3 to 4.5 hours from symptom onset, though sometimes longer with advanced interventions. If a patient with an ischemic stroke reaches a hospital equipped for stroke care within this time frame, they may be eligible for treatments like thrombolytics, clot-busting drugs like TPA. These can dissolve the clot and restore blood flow. Mechanical thrombectomy, a procedure where doctors use a catheter to physically remove the clot from the brain artery. The sooner treatment begins, the better the chances of minimizing brain damage and improving recovery. 5. Stroke risk factors. Know your risks. Understanding your risk factors is key to stroke prevention. Modifiable risk factors, those you can control or manage. High blood pressure, hypertension, the single most important controllable risk factor. Diabetes, damages blood vessels throughout the body. High cholesterol. Dyslipidemia, contributes to plaque buildup in arteries. Cigarette smoking, damages blood vessels and increases clotting. Risk, excessive alcohol consumption, obesity, and overweight. Physical inactivity, heart diseases, especially atrial fibrillation, AFib, which can cause clots to form in the heart and travel to the brain. Previous stroke or TIA, non-modifiable. Risk factors, those you cannot control. Age, risk increases significantly after age 55. Family history, having a close relative, parent, sibling who has had a stroke. Race, ethnicity, African Americans, Hispanic Americans, and some other groups have a higher risk. Sex, men are slightly more likely to have strokes at younger ages, but women have more strokes overall and are more likely to die from them, especially at older ages. 6. Proactive stroke prevention, your key to a healthier future. Good news is that up to 80% of strokes are preventable by managing risk factors and adopting a healthy lifestyle. Healthy diet, reduce sodium intake. The American Heart Association recommends less than 2,300 milligram a day, and an ideal limit of no more than 1,500 mg per day for most adults. Limit saturated and trans fats found in processed foods, fried items, and red meat. Eat plenty of fruits, vegetables, whole grains, and lean proteins like fish, rich in omega-3s. Consider diets like the DASH or Mediterranean diet. Regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic exercise like brisk walking, cycling, swimming per week. Maintain a healthy weight. Don't smoke. If you do, seek help to quit. Avoid secondhand smoke. Limit alcohol. If you drink, do so in moderation, up to 1 drink per day for women, up to 2 for men. Regular medical checkups. Monitor your blood pressure, blood sugar, and cholesterol levels. Adhere to treatment plans. If you have conditions like high blood pressure, diabetes, high cholesterol, or heart disease, take your medications as prescribed and follow your doctor's advice. 7. Recovery after stroke. A journey of rehabilitation for stroke survivors. Rehabilitation is crucial. This often involves a team of specialists, physical therapists, occupational therapists, speech-language pathologists, and aims to help individuals regain as much independence as possible in movement, communication, and daily living activities. A stroke is a medical emergency. Knowing the F.A.S.T signs, calling 911 immediately, and understanding how to actively prevent stroke through lifestyle choices and managing risk factors can save lives and reduce disability. Please share this information with your loved ones. Together, we can fight stroke and build a healthier community. Thank you.